The internet is full of bro science, fake knowledge, half information, or propaganda. Your quest of reliable, authentic health information ends here. So subscribe this channel and hit the bell icon, and you never have to go anywhere else ever again.
Hello everyone, how are you today? I am Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. As you know, we make videos about health and healthcare topics, and today we are going to talk about bovine growth hormone injections. Ji haan. Yes, those injections which are injected into cows and cattle in order to obtain more and more milk from them. And is it okay, right? Is it safe, right? The questions are, does it actually increase the risk of cancer in humans, right? Does it, because people know that injections are given to cattle as well as antibiotics are needed. So why are the antibiotics given? Are there any risk for infections or development of more resistant bacteria because of these antibiotics? And are there any risk of these to actually go into humans, right? And what is the risk of these growth hormones being active inside humans or not? So many questions are there regarding this topic, and because this basic injection is being used all over the world except for few countries, right? So what is the science, what is the basic behind this? And most important question, because the reason why people actually ask other people to stop drinking milk, one of the reasons is this, that they think that it might cause cancer, right? Because initially before old studies used to show this. So what is the basic, right? Let's talk about this, right? This is basically recombinant bovine growth hormone, recombinant bovine RBGH. These are the injections. See, what happens is, there is something called as somatotropin. Somatotropin is your human growth hormone, which is basically increasing the cell growth and cell replication inside few types of cells, right? And it basically does its work by increasing something called as insulin-like growth factor, IGF-1, IGF-1, right? That is what it increases. So what happens is, this somatotropin is basically secreted by your own pituitary gland in your brain, and it increases the growth of many organs, many, like even including your muscles, including your breast tissues, other things, right? For females, mastitis, female, etc., many things. So the idea is, this recombinant bovine growth hormone, when injected into cattle, it increases the IGF-1 levels, increases their cell replication, the growth of their milk, and therefore milk production increases, right? So that's why this is used. In 1993, the Food and Drug Association, FDA, US FDA, approved the use of RBGH, human growth recombinant bovine growth hormone, in cattle, right? They approved it after considering a lot of studies, and there were a lot of studies done by not just FDA, by 8 other associations just like that, and that's why it is still approved in the US and many countries all over the world, including India, right? But a few countries like Canada and some European unions and other few countries, they do not use it, right? Now that's up to them by their own research or whatever. The point is here that what does the research show? Number one question, does it actually increase IGF-1 levels? And if it does, what is the effect? Does it actually cause cancers, which was the likely research in the initial phase? So, but later on the researchers proved it wrong, right? The point is, if some people actually are drinking this milk which has been taken out from the cattle or cows which are actually given those injections, RBGH, these people have been seen to have 10% higher insulin-like growth factors in those cows. I mean, the cow's milk has 10% higher. So these people who actually drink them regularly have 10% more IGF-1. Okay? But the same level has been seen if the person is drinking not milk but soy milk. So it's very evident that it's not actually the cow's milk, it's actually the protein, the minerals, or some other component which is causing the higher IGF-1 levels, right? Obviously milk, any kind of milk has growth, has hormones, right? That's why it's important. But the quantity of these hormones, if we are given to children, say infants, see, because FDA approved the use because of actually considering the worst case scenario, right? Number one, the extent of the absorption of this IGF-1 hormone is not sure. That how much does it get absorbed? Even if it gets fully absorbed, even if it increases your growth hormones completely, considering that even if you take, if a child or you take 1.5 liters, right? First thing, they actually considered it in a child. If in an infant or child, they take 1.5 liters of this recombinant bovine growth hormone associated milk from a cattle or cow, even then the increased amount of growth IGF-1 in that infant will be less than 1% of what already the infant is producing inside his body, inside the body. So your body itself produces a lot of insulin like growth hormone, right? Irrespective of what you take. That's why the FDA approved it, and that's why it's still approved in the US, right? And that's why it's approved in India. So number one reason, that does it cause growth hormone increase, IGF-1? Yes, it does. But does it cause a problem? No, it doesn't. Does it cause cancer? Absolutely not. It has been proved many times that it is not associated with increased risk of cancer, which was previously thought, and because of which many people still don't take it, right? So it's not associated with cancer. That this is directly coming from the American Associations of Cancer Association Society. So you can go and check it on their website also. They also say that they don't think, and they agree that it does not cause any cancer. So Cancer Association says that, then it must be true. And Americans use it, then why don't Indians? Then second point is, does this recombinant bovine growth hormone is active in humans or what? Whether this hormone will cause problem, then the answer is very simple. Number one, it is not active in humans, right? Recombinant bovine growth hormone does not affect your receptors, your hormone receptors. Number two, it is destroyed in the intestine itself. It does not even get absorbed. Solved. Third thing about antibiotics. See, what happens, there is a side effect in the cattle. If you give these injections repeatedly, the cattle, their growth increases, their actual growth rate of milk increases, so milking increases, so there is more chances of mastitis, inflammation, infection of the milking area, and that's why they require more antibiotics regularly, right? Whenever they have mastitis, they have more antibiotics, and that's why the bacteria which regularly infect cattle, they will get a little more resistant to those antibiotics. These are the cattle antibiotics. But are these the same which are transmitted to human? No. How much of them are transmitted to human? No. Right now, that data is not present. More research is needed on that. But then, that is where research is going on. Okay. So, but till date, there is no such issues. Right? If there will be, FDA will think about it and do something about it, and US will do something about it. We are not supposed to do that right now, right? So that concern is obviously there, but research is going on. Then third big issue is about IGF-1. I have already told. Then this thing, so that's all about it, right? What you need to understand, that okay, any milk which is taken up from some cows or cattle which are given injections are not harmful for you, will not cause cancer, they will not cause any extraordinary symptoms or hormonal imbalances. They are quite safe, very safe. It only produces a little bit higher IGF-1, which are similar to what will happen if you eat a little bit of more soy or take a little bit of more proteins. So same as that, right? So it's good to go. Don't worry about it. If you want, I'll give a link of that research article, and there are many such research articles below. Go and check yourself. And if you trust me, then you do trust me. I'm Dr. Paramjit, and you're watching Doctor Education. If you want to talk to me, you can download DocWise application, Librate or Practo. These three are the link where you can talk to me online. And the links are given below. So stay connected and stay healthy.